A coronavirus hotspot has emerged in Gainesville, Georgia, where Elizabeth Larkins is Director of Critical Care at Northeast Georgia Medical Center.
This is a COVID-specific ICU that we opened recently to ensure we can care for the sickest of our patients.
This is a mobile field hospital. So this will be basically an extension of our current emergency department.
And this is exactly where we are providing care to patients here in our mobile hospital unit.
You just have to realize that what is actually happening around the world is definitely possible.
Really scary, not knowing if I was gonna ever get out of the hospital and see my family or kids again. And it was that serious. I think a lot of people, they really need to understand that.
Deb Stevers was one of my nurses. She worked here for 15 years. She took care of COVID patients. She became sick. She was our patient for weeks, and then she passed away in our care.
I was very healthy before I got this. I hadn't been sick in probably over 2 years. Even if you're healthy, don't think that you can't be affected by this.
I don't know that I've ever seen a better community response.
You're the ones that have helped stop the spread. You're the ones that made sure that your hospital did not get overrun.
At a time when the masks weren't as readily available as they might be now, our families were desperate. And so the health system kind of pivoted and helped us get those made and distributed.
And Northeast Georgia Health System came to Good News Clinics and asked if we would host alongside them some community testing events geared toward the low-income population.
The hospital has really reached out to reach business owners, workers in the community to say, hey, we want to make sure we cover everyone in the Hispanic community.
We could come up with guidance when there was no guidance, and if we worked as a team, that we could really take care of each other and our patients.
Our focus as a health system is to continue to try and educate the community as to the safe practices if they do decide to open.
Our physicians, our nurses, all of the caregivers at the bedside are true heroes on the front line.
CBS 2's Tony Aiello spoke with one physician who is from Georgia.
Mugel is an ER doctor at Northeast Georgia Medical Center. Volunteering to serve in New York City, Mugel comes to New York to help, but also to learn.
We wanted to help out our colleagues in New York.
We cannot do community health improvement work by ourselves. We each bring different perspectives and we each bring different strengths, and we all have a part to play.
Code Believe. Another COVID-19 patient is well enough to go home.
Clear. He's one of our firemen. He's been in VFIT for approximately 10 minutes now. Request orders will be there in approximately 5 minutes.
When we talk about this as his heart was starting to die, every second, literally, that went by, his chances of dying went up.
I'll never forget. We pulled in. All I could see was a sea of blue uniforms. We didn't know if he would ever be able to work again or what our home life would be or how I would explain it to the kids.
We knew that the emergency department was going to do what they had to do. And then cardiology got involved. And then the intensive cardiologist got involved. That teamwork is the reason that he got to hug his kids in a matter of a week or so.
Something unique that I think our system has done has brought out that deep interdependence outside of the hospital and invested in the community.
From the start, Northeast Georgia Medical Center has been very supportive of the robotics program. We've seen surgeons from all over the country come to Northeast Georgia Medical Center to get their education on how to operate and do robotic surgery.
It's not just us, it's the whole deal where people are coming to watch, how do these guys do this? How do these guys do 4 and 5 cases a day?
Collaborating with the county, we were able to cut response times down dramatically.
Probably reduce the response times within the city limits of Winder probably in half by about 4 minutes.
We have a vision and a passion that's mutually aligned for you to grow, as well as making Northeast Georgia Health System better tomorrow than it is today.
Compassionate care, expert care, just always improving
That's how I would describe Northeast Georgia Health System.
And we know that this will provide increased opportunities for patient, staff, and physicians as we move forward.
I'm Monica Newton. I'm the Family Medicine Program Director here at Northeast Georgia, and I'm joined by my colleague, Dr. Jim Kruer, the Internal Medicine Program Director, and here we are in our brand new building in Medical Park 2 here on Jesse Jewell.
We're really excited about the space. It's going to allow us to do so many new things and do basically state-of-the-art training for our physicians in the internal medicine practice.
I had a piece that I was in good hands as far as the medical team.
Even from the housekeeping to the top, they went above and beyond.
It was just absolutely amazing how they took care of him, but not only him, they took care of me as well through this whole process.
I just love the atmosphere that the hospital provides. They treat you like family. When I did have to go back in the hospital, they even brought him to me in his own little incubator with his oxygen tank. That night, I just cried and cried. They're always gonna have a special place in our heart, and we will never forget them.
Going into 2020, I thought I had seen everything. I'll never say that again.
Welcome to our bariatric cooking class. Today we're doing things a little bit differently given the circumstances.
We're physical therapists with Northeast Georgia.
And we're here to show you a couple of exercises you can do at home to get fit.
Together we can help our loved ones stay healthy.
As of today, we are letting moms that are COVID negative come and visit their babies in the NICU.
We did approximately 20 to 30 visits a day, virtual visits. I mean, it was probably the most rewarding moment throughout COVID is to be able to participate in the life of our patients and our family members.
And I truly think it's a testament to being a community health system. That when we say we're in it to improve the health of our community in all we do, this is just another way that we're doing that.
Betsy Farmer's co-workers were there to cheer for her husband, Judge, when he was released from the Northeast Georgia Health System in Gainesville because they were the ones who treated him.
It was the hardest thing ever. Truly the hardest thing ever.
Hey y'all, this is Bill from Papa Jack's. I just want to take a quick second and say thank you for all the staff and medical workers out at Northeast Georgia. Y'all have been great. From the bottom of our hearts, from here, from my staff and me, we just want to say thank you for all you've done. You're the ones on the front line. We love you.
Hey, this is a few of us from Charleston Church. We just want to say a huge thank you for all that you do.
On behalf of the Lowe's in Gainesville, Georgia, thank you to all the first responders and healthcare workers. Keep up the great work.
Perhaps more than any other time in our organizational history,
Northeast Georgia Health System has been put to the test. COVID-19 has tested our resolve.
The people of Northeast Georgia Health System have risen to the challenge.
Our core values define who we are as an organization. And times such as these are when those values shine brightest.
The actions we took each day were ensuring tomorrow.
This time has been called unprecedented, challenging,
uncertain,
a crisis for the ages.
We choose to view it as a time when the people of Northeast Georgia Health System came together like never before.
To demonstrate to ourselves and the world what we have known all along.
That we truly are committed to improving the health of our community in all that we do.
Thank you, healthcare heroes. You are awesome.